Hi everyone, welcome to another episode of SPED Talks with me, your host, Donna Steele. Today is International Day for Persons with Disabilities, December 3rd. And with that, I will focus on specific learning disabilities. I'll do a brief overview of what that is and what are some of the disorders that fall in the category of a specific learning disability. Very briefly, it's just an overview, nothing in depth right now. Next season, I hope to really delve a little bit deeper in those different areas. So let's get to it. Specific learning disabilities. Do you know someone who's having trouble processing information, organizing information, or merely applying the information? If this happens over a consistent period of time where every time this is an issue, then this person might have a specific learning disability. What is a specific learning disability? According to IDEA, this means a disorder in one or more of the basic psychological processes involved in understanding or in using language, whether spoken or written, that may manifest itself in the imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations, including conditions such as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. But I said a lot just now, and I feel like just by saying that you kind of get lost in the words, so the meaning is not that explicit or clear. So what I like to tell people when I try to define a specific learning disability, I just tell them to think of it as a discrepancy between a person's performance and their actual potential. So when they perform, so for example, a child who might have a learning disability in reading, that child or be dyslexic, which we will talk about a little bit more, that child's performance in reading may be very low in terms of the output, what we actually see, but given the strategies and everything that child may need and the necessary accommodation, their potential is actually greater, if that makes sense. So they're capable of doing much more, but what you're actually seeing is not reflecting their capability. So when I talk about a discrepancy, that's what I'm talking about. What you see on paper does not give us an indication of what that person can actually do. Types of learning disabilities. So and I'll start with the most common one. The most common one that we always hear about is dyslexia. And it simply put, is a language and reading disability. And I won't go in depth for the sake of this presentation, but in season 2, which will be next year, I'm giving you guys a little preamble as to what to come. But in next year, I will touch on each of these in an in-depth manner. And then you have dyscalculia, which is problems with arithmetic and math concepts. You have dysgraphia, which is a writing disorder resulting in illegibility, where so the writing isn't clear. You have dyspraxia, which talks about, which is basically a sensory disorder, problems with motor coordination. Then you have what's called a central auditory processing disorder, difficulty processing and remembering language-related tasks. Then you have a nonverbal learning disorder, trouble with nonverbal cues, body language, poor coordination, so a child might be clumsy. Then you have visual perceptual, visual motor deficit. This is where a child might reverse his or her letters, cannot copy something that's presented to them accurately. And then you might have language disorders, which is trouble understanding spoken language, poor reading comprehension. So these are just some of the main types that we as educators see all the time. And again, like anything else, you can have a combination of more than one, as well as other disabilities that I will not touch on in this presentation. Causes or presumed causes. So no real causes. That's what some of the literature says. There are no real causes, as well as causes might be hereditary, medical, environmental. And sometimes that people, a child may have brain injury and that may contribute to it. So this is just based on the literature. Incident rates. There's an estimated 15% of the US population who is said to have a learning disability. 6% to 8% of school age population in the US is said to have a learning disability. And as for Jamaica, I do not have those incident rates. I could not find any. But this just gives you an idea as to what we're looking at. And the US population is a big population. Approaches used to diagnose a specific learning disabilities. Usually the diagnosis comes after you would have noticed that a child or a person is having learning challenges in whether one or more areas. So you might find that a child consistently has problem reading or writing, no matter what intervention is in place in the regular education. You realize that the difficulties persist. With that, a parent or a teacher may have concern and make a referral. Well, do you remember when we talked about the evaluation process and what that looks like? So usually it's after those difficulties, learning difficulties persist, then a diagnosis is usually made after that. It's not usually made like you take your child to a regular doctor's visit and they're like, oh, you might need to take this child to a psychologist to get assessed because he or she has a learning disability. It's one of those hidden disabilities. You don't look at a person and determine that they do have a learning disability. Another way to diagnose it, well, the first one wasn't a way, but that gives us a clue in terms of what we need to do. And one way, pretty much this is the only way, psychological or educational testing will be needed to diagnose a child as having a specific learning disability. So whether a certified psychologist, educational psychologist, or an educational therapist who has been trained to do this, then these individuals, given the relevant tests, can ascertain that a child, or an individual rather, has a specific learning disability. That brings us, does my student have a specific learning disability? You ask yourself these things after you'd have realized are the reading characteristics, what characteristics this child is possessing in reading, what is this child showing me, reading characteristics that are opposed to what successful readers produce. The same thing for writing. The writing may look illegible, number sequencing and mathematical computation. So you're looking at those characteristics that the child is showing you, what the child is showing you, and what are the actual characteristics that the child need to have to be successful. And you're making a comparison, a comparison between the two to determine if this child, you suspect that this child might have a specific learning disability, hence you make the referral. General characteristics of specific learning disability. And these are general because I'm not zoning in on any one specific learning disability. Most students exhibit uneven areas of ability. So they may be successful in one area, but in another area, for example, they may be successful in reading, but when it comes to math, they fail miserably. So it's not consistent across the board. And that's how you know it might be a specific learning disability. Hence the word specific. That word is very important when we talk about it. A student might be good in one area of language and not the other area. student is physically normal. And I alluded to this earlier when I talked about it not being a disability that you can look at a child and say this child or individual has this disability. So we look the child or whomever that will be diagnosed or have been diagnosed looks normal. You're looking at me right now, and I do have a specific learning disability myself. But I was not, I did pretty fairly well in school, but after being a part of the special education profession, then I realized I do, or I did. Well, I do. It doesn't go away. I've just learned how to, manage it through strategies. Average or above average intelligence. So a specific learning disability has nothing to do with your intelligence. Average people or above average people do have a specific learning disability. So it has nothing to do with whether you are cognitively not able to. You usually are. It's just that you have a deficit in a specific area or several areas, but it doesn't affect your intelligibility, if that makes sense. Commonly found in gen ed classes, yes. Because some people normally think, oh, this must be a special education class that has specific learning disability individuals. And yes, we do have that because it is a disability, so special education does come into play. However, a lot of students in our gen ed classes or regular education classes struggle. And we as teachers and educators, we suspect that they might have a disability, but we don't know for a fact because they have not been assessed or evaluated by the relevant persons. But a lot of our students go undiagnosed, and some children, because they are of average or above average intelligence, they eventually learn, those coping mechanisms, those strategies that can actually help them to be better, or to try to be as average as possible in those areas that they're having issues with, especially the older children. Many SLDs need to be medically diagnosed. And there are instances where many students with a specific learning disabilities, their diagnosis came from a medical doctor. Instructional ideas, like anything else, as teachers, whether you're a special education teacher or a teacher in the general education setting, you're going to have to provide for these students, and you're going to have to help them. So of course, I've put together some instructional ideas for you, and parents alike can utilize these as well. So you're going to want to repeat and summarize information for these students. You're going to want to provide them with oral lecture notes, if possible, written versions of key points, just to help them. So you're providing a little bit of accommodation. Verbalize what is being written on the chalkboard and read aloud material contained in handouts. So you don't want to take it for granted that this student is able to. So you want to provide as much help as possible. Send students a copy of this for upcoming semester year so that students can get a jump on it, on the reading assignments, because some students, as we have talked about in that episode when we talked about accommodations and modifications, some students need that time to process the expectation of what is coming up. And teachers should support learning with visuals. That whole differentiated learning approach, you want to make sure you try as best as possible. I know it can be hard and timely in terms of your preparation for same, but you want to provide where possible, whenever possible, as much as possible, those visuals, those auditory assistance, tactile, whatever the case may be, to provide with as much assistance as possible. Stressing step-by-step instruction. So you want to take it, and if it's a multi directional instruction. You want to, you know, slow it down a little bit, your pacing, do this first and have them do it. Then you say, then no, this is what we're going to do. So stress, so you want to stress the step-by-step instructions, because a lot of them get lost into that organization, processing that kind of information. And here are some accommodations that teachers, again, can use during assessment. Choose an alternate exam site away from the general education classroom. Ensure that this is alternate. This alternate location is free from auditory and visual distractors, because as some, like I said, some SLD students, they do have other disabilities, and a lot of them also have ADHD. So you want to make sure that, you know, their area is free from distraction. Avoid confusion in terms of use of complicated language, and or consider substitute exam or assessment if possible. And usually if a student has an IEP, these are accommodations that you can definitely make. A student who doesn't have an IEP, you're not tasked legally to necessarily do that. But those with an IEP, these are some of the things that you can consider as a team to make changes so that the child can perform to his or her true potential. Allow students extra time to complete exams, assignments, especially if there are unique demands regarding reading and writing skills. Again, if they have an IEP, you will know exactly how to mesh that accommodation. Use of technology as an accommodation. This is a big one for SLD students. For writing assignments, students with a learning disability should be allowed to use a computer if available, so they can get spelling support through the spell check program. So if it's a case where you're not checking for spelling, in terms of that's not a part of your rubric and the child can get away with it, then you would want the child to use a computer so that that can help with the spelling support. Students with dyslexia may find that writing assignments are more easily completed on a computer. For some reason, a lot of dyslexic students tend to do better on a computer. Try to consider trying using software, as Kurt's words, which reads textbooks and their materials. So you have a lot of software out there that will help with reading the textbooks and other materials. Again, if it's a case where reading is not being assessed in terms of decoding words, then you can go ahead and use a software that will help them to decode the words if it's a comprehension case where you're grading for comprehension rather than decoding words. Now here, I am sorry, I apologize for having the computer blocked what is here, but it's the Kurt's Ways software that's covered here. I apologize again, just realizing it. Use of assistive technology as an accommodation. This is where teachers may allow students to use calculators during math, is concept attainment and not necessarily. So if you want them to, and not necessarily in terms of rote, like for example, multiplication concepts, if that is not the case where you want them to compute something and you're not grading for computation, then you might want them to use their calculators for concept attainment. Allow students to tape record lectures and or notes for students. So that's something that you can use. So the assistive technology here, it would be the calculator, the tape recorder. Assessment, allow for alternate forms of assessment by allowing students to demonstrate learning through a number of different ways. A number of different assessment types, such as portfolio, slide presentations, photographic essays, or taped interviews. Again, and this is where that differentiated instruction approach comes into play, not just giving them one form of assessment when we have several different types of students with several different types of needs. We want to mix it up a little bit. And that is it. It would be very short, just an overview. because we will touch on this again, where I will look at each disability, specific learning disability rather, in an in-depth manner. So stay tuned for that in another episode. We have it, specific learning disabilities. It was very short, so I hope you got the gist of what that is and what it looks like. And again, as usual, if you have questions, comments, concerns, or just an opinion, shoot me an email, DM, whatever the case may be. Until next time, this is Donna Steele saying goodbye and happy December.